Hi, my name's Michelle Southworth. I'm the director of the certificate program at Council for Relationships in Marriage and Family Therapy. And we're going to talk a little bit about some of the aspects of the program that may be of interest to people who are thinking of joining us here.
Good morning, and I am Tiffany Smoot, the Postgraduate Training Program Academic Administrator.
Today we thought we would talk about some of the questions that people ask when they are interested in considering this program. We're going to do it in a question and answer format, so it's easy to follow what we're talking about.
Michelle, I know that we're getting ready to celebrate our 70th year of the postgraduate training program with our graduation coming in July. So can you tell me a little bit about Council for Relationship and the postgraduate training program and the history in training the clinicians in our organization?
Yeah, well, you're right. We are graduating our 70th class this July, and we're pretty excited about that. So we've been around for a long time. Marriage and family therapy is actually a relatively new profession. We didn't even have licensure of marriage and family therapists until 2002. So we've been doing this a long time as the field has been developing, and we've been at the forefront of a lot of that development. It's kind of an exciting experience to be part of such a new field, and we've really valued having a chance to play a leadership role.
So Michelle, I know that you yourself graduated from the postgraduate training program. So why do you think people are excited to come to CFR for their training?
Well, one of the reasons that people come here is that it's a unique program in that you can come with a master's degree and not have to get another master's degree. So it truly is postgraduate clinical training. We have the reputation of providing an in-depth, systemically oriented family therapy training, which is not something that's always available in other training programs. We're also known for getting people off to a really good start towards licensure and for providing a high quality teaching and supervision experience for people in a sort of an intimate and supportive atmosphere.
So as we see so many people come through our training program of different ages and for many different reasons, what would you say is the typical type of student that you see? How would you describe that person?
Well, as you say, we've got so much variety, it's hard to say one typical kind of student, but we've got a couple of areas that we see a lot. So generally it's master's level people. Sometimes these are people who've been out of the workforce for some period of years and want to refresh their clinical skills and work towards licensure. Sometimes it's people who've been in more administrative roles and also want to refocus their work on clinical skills. Sometimes it's people who have actually a fairly active clinical practice at a master's level but want to specialize in marriage and family therapy and get the benefit of not only the teaching but the supervision that we offer. And then the other area in which we're also kind of unique is that we offer a track for clergy who are interested in sharpening their clinical skills, their counseling skills, and also in obtaining a clinical license, which is something that's not readily available in most circumstances to clergy. We've also got a sex therapy program, a one-year program, that is designed for master's level clinicians who have some family therapy experience working with couples generally, who come for 1 year to get trained in specific sex therapy approaches to sexual issues that couples may present.
So along with having so much a variety of people that come to the program, which is an awesome opportunity, what else can you offer as far as the strengths of the postgraduate program?
Well, one of the strengths that people seem to appreciate is that you get a combination here of the education, the supervision, and the clinical work all at one location. So it's all kind of, you can do it together. You don't have to go out of here to do an internship or something like that. We're also very flexible in terms of working with people's schedule to set up the coursework and the supervision and the clinical hours in a way that works with people's various schedules. We have a lot of different ways that we can do things, and once you're admitted, we work with you to make it work for you. You work with experienced clinicians. The people who are your instructors and your supervisors are actively doing clinical work as sort of their main occupation. So they're very up to date and very conscious of clinical issues from their own experience. We have pretty high standards of excellence in a very warm collegial atmosphere. And I think people experience a lot of personal and professional growth as a result of the individualized attention that they get and the support that the program offers to the students.
Michelle, you mentioned a little bit about the faculty and supervisors. Can you tell me a little bit more about the two?
Yeah, quite a few of the faculty and supervisors are actually people who have trained in this program. People tend to stick around because the atmosphere is a very nice working atmosphere. So we've got a wide range of different qualifications that people have. We have licensed clinical psychologists on staff, licensed clinical social workers, licensed professional counselors, ASECT-approved sex therapists, and of course lots of licensed marriage and family therapists, which matters in terms of people needing to be supervised by certain professions depending on what license they are going for. And as I mentioned, everyone who teaches or supervises on our staff has a clinical practice and is actively involved in seeing clients, so that they really are very cognizant of the kinds of issues that clinicians deal with from their personal experience.
So Michelle, what do the alumni say after they've gone on and they've graduated? What do they say they've received as a benefit of the program? What have they gotten out
I
of
would
it?
say the main thing that people say, and people say a lot of things, but they generally center around a deeper understanding and more advanced skills as clinicians, and particularly as systemic clinicians. But also I think people feel like they have a deeper self-understanding as part of the learning process that they went through here.
So Michelle, you talked about what the alumni has said about the program. Can you tell me a little bit about what they're in the process of doing now that they've graduated and went on? What can you tell me what they do after they leave the program?
A lot of people go into practices of various kinds: private practice, agency practice. Some people go back to practice in the field that they came out of when they came to the program. Might be the military, it might be their responsibilities to their congregation. We have people who've worked in the prisons who've gone back to the prisons to continue their work. Some people get focused on teaching and supervising, and then we have some alumni who have gone on to be leaders in fields where they have particular interests in particular projects. We've got one alum who is running a men's center in Philadelphia, focusing on men's mental health and making therapeutic services available to more men. We've got another one who is specifically focused on reducing the stigma of talking about mental health among Black men, who has a very innovative project that's designed to help open that conversation up. We have people who write articles and books in their areas of specialty. It's really a pretty wide open set of opportunities that people find coming out of this program.
So Michelle, thank you for this time, and thanks for allowing me the time to ask you the questions about the program. We have so many questions that people ask after they've either visited or looked at our website, and so I'm glad we had this opportunity to clear some things up. So what would you say are the next steps for those that are interested in the postgraduate training program?
Well, we are generally available to talk. Our contact information is on the website, so if people want to email or give us a call, if they have additional questions, we're always happy to talk about the program. The application is online and should be pretty easily accessed from the website. So we look forward to hearing from you.